On any day, in any circumstance, healthcare workers or healthcare heroes do difficult work. Nurses fight for the patients who they've come to know and love. Doctors work around the clock, researching innovative treatments for those in their care. Administrators huddle behind the scenes to make necessary decisions with everyone's well-being in their hands. Security and EVS ensure the physical safety of everyone in their facilities. The job is never done. It's never been easy work, taking care of people in the greatest time of need, but the challenges you all face this year have been unimaginable. And you, the team members who keep Paris Regional Medical Center going, have repeatedly stared illness, fear, isolation, sorrow, exhaustion, and so much more directly in the eyes and said, "We've got this." You continued to persevere in the face of adversity, and we couldn't be prouder to honor you. These are the stories of our healthcare heroes.
We had multiple cold blues and we had multiple rapid responses, and it was like almost every hour and a half, at least every hour and a half, they just kept being called and kept being called. And I kept responding just as an administration to go and help where I could, and everywhere I went, everyone was just working so incredibly hard, regardless of what unit it was. No one was sitting down. Like, it was just a day that if you could have truly watched from the outside, you couldn't be more proud of the way everybody worked that day.
I do remember that we had a little guy that wanted to get out of the hospital so bad so he could go visit his mom in the ICU before she got vented. So it's hard.
It's hard, yeah. But I just went home that night and I was just so heartbroken just over the way things are going. It's nobody's fault. There's nothing specific that you can pinpoint, but it was just one really, really sick patient after the other. And one specific patient we had lost, and they were younger than I am. I'm not young, but I mean, you know, when you start taking care of people who are dying that are younger than you are, it really touches you, and you're just like, it's not supposed to happen that way. And but like I said, it was just one really sick person, one code right after the other, and it was just, I couldn't sleep. I was mentally, physically exhausted, and we felt a little defeated that day. But again, we came back because we knew we needed to be here, but it was a pretty tough day.
And I have been really impressed by the way that our staff here has jumped on the learning curve. It's been real quick and steep. And I'm just proud of everyone who works here. The way that they have stepped up to the plate and stood up for this community. And I'm just privileged to be a small part of that.
You kind of hear that slogan, you signed up for this. Nobody signed up for this. But what we did do is we came together and we figured out a way to get through it every day, every 12 hours, and every shift. But I think overall, most of us were prepared. We just didn't know when it would happen, and it happened to happen in 2020. So I think we were prepared.
Everyone is a family in the cath lab. We try to work together, and coming to work, I know that my fellow co-workers, they're like my family, and I can always count on them.
If somebody's sicker to me, if somebody's family in front of me, as a provider, I have to do whatever I got. Sometimes it's very hard to talk on the book and dealing with the real patient, because somebody is not coming to see their loved one. They rely upon you, me, as an organization, that we are up front and taking care adequately. And That's why you do as a team. It is not all about one person and two person. It is all about incredible nurses, incredible people who clean our floors and room, people who feed them dietary, everybody putting their life. Sometimes, the other part of the people don't realize that, this is a life-threatening disease. Everybody, all team members know, but every day they come in the morning and they smile and take care of people. So that's incredible organizational skill. And again, it is all about everything, all about community, because you can't back off. We got the problem, we got to deal with it. So that's what we have to do. You fight and we will win. That's all I think.
Take care of the floors, keep them shining, trying to keep them clean, keep the germs out. That's my job, and I've been doing it for 45 years, and I enjoy doing it. And whatever else need done, I'm here to do that. And that's what I'm used to. Everybody working together, you can accomplish a whole lot out of life, and it's just a good feeling.
We started to have more ICU care and more patients coming in, and our ICU was more stressed. Actually, our workload increased quite a bit. I think not just the physical workload increased, but also the psychological work of taking care of people that are more critically ill and that you might not be able to help. And also having restricted resources. All of a sudden, things ran out. Not necessarily so much here, but we would restrict things because we couldn't get more.
We had an elderly gentleman came in with what his son thought was CVA symptoms. We did all those tests to rule it out. We ended up doing a COVID swab on him, and it was positive. He was confused the whole time, and he would take my hand or the other nurse's hand, and he would just sit and rub it, just like my husband does mine. And the son was with him, trying to keep him calm. And all I could think about is he's not going to see his wife. He thinks we're his wife, sitting there holding. I cried that day. I cried that night when I got home. And I just asked my husband, and I said, when I got home, I said, just hold me. Don't say a word, just hold me. Because, that's what's unfair. That's what's unfair to me about COVID is when the patients are the sickest, they can't have who they need with them. And that one man just stuck, and he passed away a couple of weeks later.
Something that we've never encountered before. It took place, it all started about March. I think that it's driven us to be closer to our families. It's kind of driven us to our neighbors. It's just really kind of brought us together a little bit. I know here at the hospital, we've really relied on teamwork, and we've relied on each other a lot. And so I think it's just driven us to be a little bit closer.
To my coworkers, I would like to just tell them thank you. I know that they are mentally and physically exhausted, but they continue to come back day in and day out to take care of each other as well as our community. And so again, they've just shown their strong side and how that they are dependable and here to take care of our community.
I think the coworkers we have is capable of taking on almost any task.
It's a lot of emotional toll on the people as well, because your loved one, you work every day and they come and you see as a patient, it's just harder. So it's a complex situation. It has to be fight as a community together, including everybody responsibility. It is nothing about anything else. It is all about people's life. It is about our life, our community, our society.
God is still good, and that's what we chaplains are here to emphasize for the staff. That God is still good, and His promises are still in the Bible. I looked this morning, and my favorite verse in the Bible is still there, and no one took it out while I was sleeping. So,
as your leader, your colleague, there's nothing I could ever say or do that would adequately express the gratitude and appreciation I have for this team. I stand in awe of your selflessness, your devotion to your work, your strength and perseverance, your commitment to this community. Every day you inspire me and countless others to do more, to try harder, to be better. You are the heartbeat of our hospital and our community. It's not easy being the calm one, the voice of reason, the bearer of heartbreaking news, but you do it with compassion and grace. It's not easy carrying a heavier load at work and at home, but you do it with strength and determination. It's not easy suiting up for another shift with a smile on your face when you think you just can't go another day, but you do it with resilience and motivation. Cases continue to rise, but so do you. Whether you're caring for patients directly, making sure they have the right meals to meet their needs, keeping our facility clean and secure, or you're in one of the countless offices that ensure our hospital keeps running day and night, I want you to know you're seen, you're heard, you are appreciated, and you're loved. I salute you. Thank you.